There are many people that think that Medicare is going to be free or should be free, and it's never going to be free. There are co-pays, there's co-insurance, there's deductibles, and there are premiums. And in this video, I'm going to show you exactly how to manage your Medicare premiums. There are three different areas that I want to address in this video. Number one is the costs of Medicare. In other words, what's it cost you to be on Medicare? Well, we begin really our Medicare journey with Medicare A and B. Regardless of what you do beyond A and B, whether that's a supplemental plan or an advantage plan, we have to be enrolled in Medicare A and B. Now, for 99% of everyone, all people eligible for Medicare, 99% of them can have Medicare A, which is the hospital side of Medicare, at zero premium. It's premium free. And the reason for that is because we have, or a spouse has, paid into the Medicare tax system for at least 40 quarters, which is what? Basically 10 years worth of work. Now, most people have a lot more than 10 years, but as long as we have at least 10 years of Medicare taxes paid into the system, then Medicare A will be premium free for the rest of our life. Now, there are some people that don't have 40 quarters. So when we find that situation, we see if we can get it from a spouse or an ex-spouse. So if someone is married and they don't have their own 40 quarters, as long as they've been married 1 year or longer, and that spouse is eligible for Social Security, that spouse doesn't have to be taking, they just have to be at least 62, and they can draw those 40 quarters off of that spouse if they don't have their own. Now, if someone doesn't have their own and they're no longer married, we actually can go back to an ex-spouse and get our 40 quarters as long as that marriage had lasted at least 10 years, okay, and you didn't remarry prior to the age of 60. Unless that remarriage has ended because of death or divorce, then you can go back to the previous spouse. But if you remarried prior to 60 and you're still married to that same person, you can't get from the ex-spouse. So the point is this. We're always looking for 40 quarters. So if it's an ex-spouse, marriage 10 years or longer, no remarriage prior to the age of 60, or now you're single, then you can draw those benefits as long as they're Medicare eligible. So we need 40 quarters to have Medicare A for free. Now, there are some people that can't get it from their own work record, or they can't get it from a spouse or an ex-spouse. And then that's the group of people that has to pay for Medicare A. And again, it's only 1% of the population. So anyone that has 0 to 29 quarters this year will pay $506 a month for Medicare A. Anyone that has 30 to 39 quarters will pay $278 a month for their Medicare Part A. And again, that's the group that if they don't do their Medicare A on time at 65 or when they retire, then they actually can pay penalties for not starting Medicare at the right time. Now, if someone's close to, let's say they're 40 quarters, what we encourage them to do is go back to work, because you actually can get a quarter right now by having $1,640 worth of W-2 income or net self-employment income. So that's all you have to make to get a quarter. Now, we can't get more than 4 quarters in a year, but you don't have to work the whole year to get 4 quarters. If you needed 4 quarters, what do you have to make? $660 of W-2 income or net self-employment income, and you picked up 4 quarters, all right? So if we're close, we tell people try to go back to work and then get to the 40 so you don't have to pay for Medicare A for the rest of your life. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. All right, so that's A. Now, the B side of Medicare is not going to be free unless someone qualifies for Medicaid, 100% full Medicaid, then the state will actually pay for their Part B. But again, that's very few people in the population. So right now, I'm shooting this video February 27, 2023. So if you're watching this, in 2024 or beyond, it could be different, right? But the point is, Part B has a premium, and right now, the majority of people are paying $164.90 a month for their Medicare Part B premium. When I say the majority, right now that's about 90% of the Medicare population. And the reason for that is because the Part B premium is based upon our income. And that income specifically is called Modified Adjusted Gross Income. And the way this works, so this is 2023, if someone's on Medicare, they looked at, they meaning the IRS and Medicare, looked at modified adjusted gross income for 2021. They always look back 2 years. They don't look back one because freedom right now. Now people are starting to file their taxes and all that, but they're not due until the 15th of April, and you can file an extension until October 15th. And so they don't look back one, they look back 2 years. And so if I'm on Medicare 2023, look at 2021, they ask the IRS for modified adjusted gross. Now the adjusted gross income, we're all familiar with that. That's typically right now in the 1040 line 11. Now the modification of that is they actually add, I think that the line is 2B right now. So the line 2B is for tax exempt interest. So when someone invests in municipal bonds, or maybe they have U.S. savings bonds that went to higher education, they did not have to pay federal taxes on that interest, those earnings. They still have to report those on the return. And so they report that on that line, and they put those two together, and that becomes the number that the IRS reports to Medicare to establish your Part B premium. And so what they do is they set thresholds. And so this year thresholds are this. Anyone that's a single filer, if they have modified adjusted gross income of $97,000 or less, single filer, then you again would pay that $164.90 a month for your Medicare Part B. If you're a married couple that files a joint return, that number is $194,000 again or less. Each of you would pay the $164.90. All right? And so again, that's the majority of population. But there's anywhere from 7 to 10% of all people that are going to be above those thresholds. And so when we get into those thresholds, what happened is now we have surcharges added to Medicare B as well as Part D plans, and those are called IRMAs, okay? So that's an acronym that stands for Income Related Monthly Adjusted Amount. So again, if I'm above the threshold, IRS will report the actual number, modified adjusted gross, and now Medicare is going to add a surcharge to that $164.90. And that ranges anywhere from about $70 a month upwards to about $400 a month, depending upon your income. All right, so we're going to have to pay for our Medicare Part B. Now, keep this in mind as we talk about the cost of Medicare. When I go on Medicare, folks, here's what happens. The majority of people do not have A and B only. They're going to have other kind of insurance. So I want to make sure we're clear on this when we talk about cost. So if I get A and B with a supplemental plan, or if I am enrolled in A and B and I get what's called a replacement plan or a C plan, also called Advantage plans, either way, as long as I have 40 quarters in, my A is 0, right? Either way. My B is going to be $164.90, or if I'm high income, I have an IRMA. Over here, same thing is true. Right? So that's what these two systems have in common. If I get other insurance, other costs are going to be, I'm going to pay my B. Now my supplemental plan, and most people today, and I'm just going to give an example, most people are getting a G plan. There's other plans out there, but just to keep it simple for this video, and let's say my G plan is $125. In this scenario, if I have a supplemental plan, then we add a drug plan to that coverage. And those range anywhere from $10 to maybe $50. The average right now is about $25 or $30 a month. Okay, so when I talk about the cost of Medicare, I'm enrolled in A and B, I got to pay a supplemental premium monthly, I got to pay for a drug plan. Now then beyond that, if I have that G plan, once a year I have a small deductible, it's $226, and I'll have some co-pays for my prescriptions, all right? So I've got some other out-of-pocket costs here, but they're going to be pretty minimal, all right? Because why? I got rid of all the risk of my health care other than a small deductible through that G plan. So I paid the insurance company a premium to get rid of the liability. So if I go over here in this replacement plan, these C plans, Advantage plans, what happens is that C plan almost always has a 0 premium. You don't usually have to pay. There's some that have them, but they're very, very small. And what they also do is they add a drug plan to it. And again, that's usually at a 0 premium as well. So what happens, because I didn't pay a premium, now I have lots of co-pays over here, and maybe even co-insurance over here, because in this system, I pay as I go. So the cost of being on this plan is out-of-pocket, co-pays, co-insurance, but they will always set an annual max out-of-pocket for the year. So they do put a limit to it. And that's going to be anywhere, depending on an HMO or PPO, somewhere between about $3,000 to maybe $7,000 every year, and then that max out-of-pocket resets every January, all right? So I'm enrolled in A and B with either of these systems, pay a premium, very little out-of-pocket after that. I have a drug plan over here, don't pay a premium to the the Advantage company, so I'm going to pay as I go through copays, coinsurance, and of course copays for medications as well, up to a certain limit. So those are the costs of Medicare. Now let's talk about paying for Medicare, and I want to focus on first on just the A and B of Medicare. So if you are receiving Social Security, you have no choice. That premium, of course A is free, but that B premium is going to come right out of your Social Security check on a monthly basis. So if you start Medicare in March and you get your check in March, then that check is going to be for $164.90 less. All right. Now, if you have an IRMA, they're going to take it out of your Social Security check as well. In other words, if you're on Social Security, you have no choice. That is going to come out on a monthly basis the month that you begin Medicare. Now, if you're not on Social Security yet and you had to self-enroll into Medicare, now you're also going to have to pay for your Medicare differently because they don't have their Social Security check to pull from. So what happens is this: a couple different ways you can do it. You can be on what's called a direct bill. Okay. And that's a direct bill, and that bill is quarterly. Now keep this in mind, the very first bill could be as low as 2 months, could be 3, 4, or 5 months. I've seen all the above. That very first bill, when they set that up, 2, 3, 4, 5 months. But after that, it'll be every 3 months. So you take that amount times 3, and you would just get a bill, you get an invoice. It's a CMS 500 form, and you'll just send them a check. And you can do that if you'd like to do that. If you don't want to do that, they also have a second system you can use today, which is called mymedicare.gov. Now keep in mind, number one, this mymedicare.gov account is different than your SSA.gov account. They're different. And so this is for My Medicare. And so again, if I'm not on Social Security, I can go to mymedicare.gov. My understanding is you would have to do this every month to pay your bill this way. But a lot of people do this because my understanding is, unless they've changed it recently, you can actually pay with a credit card in that. So those of you that collect points, this would be a way for you to get points for your Medicare Part B premium. But again, I think you do have to go in there every month to be able to do it if you decide to select that particular option. Now, the easiest option, if you're not on Social Security, is what most people do, and that is called Medicare Easy Pay. Medicare Easy Pay. Now, this form can be filled out online for sure. And what this is for people that don't want to get a quarterly bill and they don't want the hassle of having to go in every single month and pay for it. So what you do here is this is basically just an ACH, an EFT. You set up an arrangement with Medicare to actually draw this out of a checking account. And so they have a Medicare Easy Pay form. You will give them a routing number, an account number, of course, all your personal information. And then what they'll do is every month, on the 20th of the month, they actually will go in there and draft out that monthly premium for your Medicare Part B. All right. And so I would say of the options for those that are not on Social Security, this one right here is probably the most common. Very easy. And then once you apply for Social Security, then that system will turn off and they'll just start taking that right out of your Social Security check. Now, keep in mind, we talked about other options. Remember, if I get a supplemental plan, most people today do that through a bank draft, through an ACH, EFT. And the reason I think that's the smartest is because once you have a supplemental plan, as long as you pay your premium, you have that plan for life. They can never cancel it except if non-payment. And sometimes people move, close out a bank account, and you got to make sure that you always keep that insurance company up to date with your routing number and account number. And so that's why it is best to pay supplemental plans through a bank draft, because then you never have to worry about having a cancellation. Because if you do a direct bill, you forget to pay it, what happens is after 30 days of non-payment, they will cancel your policy. And the only way they were reinstated is if you go through underwriting. So that can be really, really a hassle, and sometimes people can't get through underwriting. All right, so the point of supplemental plans are paid through bank drafts. When you get a prescription drug plan, what can happen with that? That actually can come out of your Social Security check if you're receiving. They can send you a direct bill, or you can do an ACH. With prescription drug plans. You have 3 different options for that. All right, then if I decide to get one of those C plans or those Advantage plans, and again, most of those have no premium, but if I do have a small premium, same thing applies. It can come on my Social Security check. If I'm taking, you can do a direct bill. They'll send you an invoice monthly, or do, again, a bank draft if that's what you're comfortable with. Now, there's one other item I want to address as we talk about paying for these, and that's this. Remember the IRMAs, for those of you that are high income? What happens is you have an IRMA on the B of Medicare, and you have an IRMA on the D of Medicare. And if you have an Advantage plan, you're going to have IRMAs. If you have a supplemental plan, you're going to have IRMAs, okay? And so the way that we pay for those IRMAs is this. If you're on Social Security, they'll take those IRMA amounts right out of your Social Security check. And again, that ranges anywhere from $700 up to $400 on a monthly basis. And so if you're not on Social Security, then they are going to do a direct bill to you, a direct bill. And they will give you, send you an invoice, and then you can decide how you want to pay for those. Again, a direct bill, you can send them a check for those IRMAs, or they actually can do a bank account, do an ACH with you as well. Or again, you can go into your Medicare.gov and pay for that. But again, if you have IRMAs, we're going to have to pay for that on the B of Medicare as well as that drug side. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. Now, the final issue I want to address would be appealing IRMAs. And again, this is for those of you that are single and your income, modified adjusted gross income for 2 years prior was above $97,000, or a married couple that filed a joint return $194,000 or above. Again, if we're in 2023, looking at 2021, we get in 2024, they're going to look at 2022. So as they look back, we're going to have IRMAs for the B and as well as for the D plan. Okay, the D is the drug plan. And remember what I said, that's anywhere from $70 to $400 on a monthly basis, depending upon your income. We actually have 5 different levels of IRMAs, okay? Now, appealing means this. Let's say that we're starting Medicare in 2023, they're looking at 2021, but let's say we have a life-changing event in 2023, which is usually retirement, work stoppage, or maybe semi-retirement, work reduction. Now, there are other options. There's marriage, there's divorce, there's the death of a spouse, loss of an income-producing property. There's a few different ways in which we have a right to appeal an IRMA. Now, we can't make up these. They're etched in stone as to what would be appealable life-changing events. But as long as we've had one of those recently or within the last 2 years, then we can appeal the IRMA. So when we get the IRMA bill, we may not have to pay that. So what happens is when I enroll in Medicare, they notify the IRS. The IRS then sends me a letter letting me know that I'm going to have an IRMA. And if you've had a life-changing event within, again, recently up to a 2-year period of time, then you can appeal it. And what you're doing is you're saying, I've had this life-changing event, I stopped working or I semi-retired. I don't want you to look back 2 years because now my financial situation has changed. And so what you do, you can, if it's this year, I can either project for 2023 or ask them to look at 2022 if that was lower than 2021. So they can look back one, or I can project for the year that I'm retiring, and they'll look at those numbers. And folks, they're frankly very happy to drop off the IRMAs, but you do have to appeal it. Now, that form is called an SS 44 form, and it's really very simple to fill out. You put down your name, your Social Security number, and by the way, if you're married, both of you would have to do one of these forms to appeal it. And you can both use the same life-changing event, the same dates, everything, because you file a married joint return. And so we fill out your name, your Social Security number, we put down the life-changing event, when that actually occurred, and then we give them what the income is going to be. Again, this is 2023. I could give them 2023, or I could have them look at 2022. And then we submit that to the local Social Security office, and we're appealing the IRMA. And honestly, all the time, everything we've done, I've seen these get approved. So it's not like they don't want to approve these. They really do. You just want to give them accurate information, have a viable life-changing event, one that's on the form, and that SSA 44. And so what will happen is they'll drop off the IRMAs. Now, I've had people that had real high IRMAs, and their income may not have gotten all the way down to here or here, but it did move down some. And so it's still worth your time to appeal those IRMAs. Even if we don't go all the way down, at least we can reduce those IRMAs. And again, you can use the same life-changing event for 2 years. So every year they recalculate these numbers. And if you work with us, we're happy, of course, to fill out all the appeal paperwork for you, get it to the Social Security office, and we'll see those IRMAs deleted.